Hello, everyone. This is Matt Polical. At this point, I'm still the owner of the Auto Physiotherapy Clinics. The partners have not booted me out, and I'm still alive, and I haven't had my coronary yet. Okay, so I do lectures like this for the level system all the time, and it occurred to me, why don't I do the exact same thing for the physios? So what I'm going to do is I'm going to talk to you about a care path. Okay, and this is a journey that you're going to take your client in on their first day of the assessment. And this is technically more directed to newer grads, but this is not limited to just new grads. There's a lot of you experienced physios who are working in the clinics that are not doing some of these things, and therefore, in many ways, it's affecting a lot of your stats and your PVAs, patient visit average, and your ability to book people. And I have created this presentation just to try to help address all that. Okay. So what's the first thing we need to focus on? Connection, right? I bet you didn't expect that marker to pop up, eh? It's pretty cool, I must say. So your first impression in many ways is a make or break scenario, right? If you go into a rental unit, you made your decision whether or not you want to rent that unit within the first 30 seconds. If you're dating someone, within the first date, usually within the first 5 minutes, you know if this is going to work or this is not going to work. Usually your instincts are going to tell you that, okay? And if you're someone like Nick, then you're going to date as many people as you possibly can because no one can connect with a guy because the guy's a nut job. Okay, so what's important in the first impression? Smiling. I'm going to talk about some things that you think is obvious, but you'd be surprised how it's not. Doesn't mean you have to smile all the time like a big clown smile and be a creep. No, that's what Peter does. Okay, but what you need to do is you have to understand that smiling throughout the whole time within reason, depending on the situation, is actually very important because it makes me reassured. Okay, if you are looking at me and you're all worried, I see a frown on your face, I see a puzzle or a perplexed face, you're not building rapport with me. Okay, what you're making me think is, what the hell am I doing here? This guy is confused. Okay, so things like that. Be attentive. Don't bury your face in your laptop when you're typing your assessment with me. Okay, don't bury your face in your clipboard when you're running away doing your assessment with me. Look at me. Look at my eyes. Okay, look at my face. Is it hard to look at people's eyes if you're naturally shy or maybe a little anxious? Yeah, it is. Does it take time to work on it? 100%. Okay, but I started exactly the same as you when I was a new grad, and I was pretty shy. I still am, depending on the scenario. And these things, these little key things, make or break your first impression in many ways. Okay, by looking at me, you're probably listening at me. If you're typing away or looking somewhere else, are you listening at me? Maybe. Okay, but I can tell you this, if I'm the client, I don't know if you are. But if you're looking at me, you probably are. All right? Make a point of saying my name sporadically throughout the assessment. Hey, Matt, after we've done this history taking, if it's okay with you, I'm going to get you standing. We're going to move your shoulder around. We're going to take a look at how things move and don't move. It might hurt a little bit, but I want you to know that I need to do this just to understand how you're moving. Does that sound okay with you, Matt? Yeah, sure. So and so. That sounds great. All right, great. So let's finish up with a couple more questions. And I need to understand how this shoulder really affects things that you like to do outside of work, for example, Matt. Where does it bother you? Okay, great. So that's an easy, laid back way of mentioning my name, covering a whole bunch of things all at once. Okay, yeah, I've already dropped the bomb that I don't really care about your pain. I care about your function. Okay, I want to look at you as an individual, not as a person with a shoulder. See, so it's a very easy, smooth way. Like, I mean, I'm not talking super fast and going like this and going blah 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 blah, or I'm not going like, hey man, what up? Okay, like this homies talk or being super chill. There's a difference between being chill and being super chill. Okay, so none of us are in Mauritius. Okay, because you're new grads, you don't know who I'm taking shot at, which is actually a bonus. But the point is, um, say their names. It builds trust. Smile. Roll it all into one. When you do that, you build rapport. Okay. It's now December 10th, 2020. So when this video is being made, I'm living in the world of COVID. Okay. It's also leading into Christmas. So are there things that we can talk about throughout the assessment? For sure. I can talk about upcoming holidays. I can talk about how awesome it is to live in the world of COVID. Okay. Throwing in random topics throughout the assessment as the opportunity presents itself builds rapport. Okay. Don't always talk about my shoulder if I'm coming in for a shoulder pain. Because shoulder pain is important, but that's not why I'm here. I'm here because I want to do things that I can't do. I'm not here because I have shoulder pain. Even though I'll be talking to you about shoulder pain, it's not the pain that I'm here for. Okay? Ask if I've had physio before. Because if I had physio at a different place and that place sucked, then am I coming into here with preconceived notions? Yes. Does that make it harder for you to build a connection? 100%. Okay. Am I scared at that point? Do I have some anxiety issues maybe because of that? Probably. So then you got to be able to sort of assess all that, ask the questions, feel it out, right? Quick fix versus long-term solution. It's important in the first assessment that you sort of bring this stuff up, because if a person's looking for a quick fix and it's an acute injury, meaning like I hit you with a hammer on your elbow and you're sore, okay, great, that's an acute injury. Though there are still stages of healing, okay? What, acute is what, 7 to 10 days, subacute is 7 to what, 14 days. Then what, it's fibroblastic phase, which is anywhere from what, 10 to 3 months. And then you've got what, maturation phase, which is anywhere from what, 2 months to 1 year. There's a lot of overlap there, okay? Is that so just by basic rules of physiology, can an injury be completely fixed depending what the injury is within 3 weeks? No, it can't. It's impossible, okay? Long-term solution. Most injuries are going to be dealing with are long-term solutions because there's usually multiple systems affected. You need to drop that into your assessment at some point. Okay, so then you start throwing the seed that, hey, you know what, this shoulder pain might explain why it's probably related to my upper back and why my upper back is sore. It might even explain why I'm getting some neck pain as well. So then what had just happened there? My shoulder's tied to my mid back, it's tied to my shoulder. There's a lot of things here that need to be addressed. Now, authority. I am a client. I'm coming into the clinic, all right? Who is the subject matter expert? Me, the client, looking up on Google, or you, the person who made the sacrifice to go to university, get those 4 years, your mark can be high enough to get to the 2 years of physio school, okay? Graduate with physio school, and then pass that freaking P&E, okay? And now get a job, and now here I am. Who is the expert? Ask yourself that question. Because if you don't know the answer, you've got some problems there. I'm going to come back to that. Right. So if you don't believe that you've earned the right to be a physio, you don't believe that you don't know what you're doing, you're done. Okay? There is no confidence. You have to give me, the client, the ability to have confidence in you. And if you're hesitant, or you're shy, you're second guessing yourself, you say, I'm not sure, I think it's this, it might be that. What are you doing, man? Like, I mean, I'm paying $100. At least that's what the assessment rates are at the time I made this video. Are you think I want to pay $100 for you to say, hey, maybe I think it's this? Right? So, like, believe in yourself. Like I said, you spent all those years in school. You are the authority. Okay? You go to a doctor and the doctor says, hey, this is what I think it is. They're going to believe the doctor. Okay? It's the same reason they should believe in you. If you don't believe in yourself, you're done. Okay? It's that simple. Okay? If you don't know what the injury is, if you haven't seen the injury before, because if you're a new grad, you can say, you know what, I've seen this many times in my clinical practice. Okay? Or I've seen this like here last week. Matt over here was just treating a shoulder with the same type of injury. These little subtle sort of comments start to make me feel that you know what you're talking about. Okay? Because again, it's back to the rapport. Provide proof. Tell me that you know what you're doing. Okay? Or that you have the ability to find out what you're doing. Okay? Never let the patient dictate the rules. Respect what they say, but you are in charge of what the exercises should be. You are in charge of what the healing rates should be. Actually, you're not even in charge. Physiology is in charge of the healing rates, okay? So let the client say whatever they want. You explain to them in a very calm and very eloquent and very non-aggressive way, and you try to show them over time how what you're saying is true. Okay? Not all shoulder injuries are going to heal in 4 months. First of all, that's impossible just based on the rules of physiology that we just covered before. So like, they're looking to you for advice and guidance. They don't realize that, okay? A lot of them don't. They come to you and they think they know and they say, this is what it is, I need you to fix it. How many shoulders are truly just a shoulder injury? How many neck issues are truly a neck issue? When you've worked long enough, you'll see it's really never that simple. Now this is our care plan. This is the document you're going to use on every assessment. And at the end of every assessment, you're going to fill this paper with the client in front of you. You're going to give this paper to the client and you're going to walk him or her to the front desk. Then you're going to hand off this client to the front desk and you're going to give the front desk this paper. Front desk will take this paper filled out already scan it, upload it in the system, and give this back to the client. Okay? In your last 10-15 minutes, you fill out this section. Okay? You talk about the expectations. Matt, your right shoulder, you want to be able to have no pain. Okay? And you want to be able to get back to volleyball. Bear with me as I write with my mouse. Okay? If I was 100% grade, I'd be doing volleyball, b-ball, and swimming. Okay? When we did the assessment, we found that you have scapular dyskinesia. I'm not going to write that out. I'm just going to waste that time. Scap D. Okay? And that's causing your impingement issues. Okay? So, Matt, I think for the first 4 weeks, we're going to see it twice a week. Okay? By then, hopefully I would have developed some motor control. And then I thought I can shave you down to 1 a week, and then 1 every 2 weeks. And here we go. Okay? Your milestone phases. So, first milestone is to be able to get your arm over 9 degrees with no pain. Okay? The next milestone will be to do some volleys with the ball, 0 pain. Okay? That's going to involve some hands-on manual therapy, definitely a lot of motor control, teaching you how to use your shoulder blade in the right sequence of muscles. Because right now, the way you're moving your arm, you're moving it, but you're not moving it the way you should be moving, which is predisposing you to impinging your shoulder. Okay? And then once you do that, we need to strengthen that. Once we build the strength, we need to work on your speed and your timing and coordination, for example, for like volleyball. Okay? If we focus on this, guess what? Your pain automatically goes away. Okay? Your mobility automatically improves. All right? You're going to learn scapular control. Okay? I'll just go scap C for now. Okay? And you know what we're not going to do? We're not going to flare you. That's what don't poke the bear is. So for now, I don't want you lifting your arm greater than 9 degrees for the next 4 weeks. All right? Okay, so now here's what you do. You call me out. At this point, assuming you've done your assessment properly, I'm probably sitting at a 7 out of 10 in terms of commitment. Probably. So what you're going to do, Matt, how does that sound to you? Is there anything here that you think that we have not covered that you think will prevent you from completing this plan of care that I've prescribed for you? Okay, so then you've called me out. Because before, people never called them out, so they just sit there, they don't book, they disappear, and they self-discharge. So this is the time where you get to catch me. Like I might say, hey, that seems like a lot of sessions. I'm not sure if I can commit to that. You say, okay, well, I'm not here to do. The rules of physiology are this. Maturation phase, whatever. You can barely move your shoulder up to 90 degrees without any pain. Okay? How do you expect to be able to comb your hair or reach above your cabinet? Okay? How do you think you're going to be able to put your shirt on? You've obviously talked about night pain, okay? And night pain is always the last thing to go away. So if we can't get your arm to settle, so you don't flare it up during the day, it's always going to swell at night, and it's going to prevent your ability to sleep well. So if we can stick with this plan, it's going to really help reduce the irritation in the shoulder, which means the shoulder joint should settle, and you're going to start to sleep a little better. How does that sound to you? That sounds like a plan. Okay. So why don't we just try it this way? And just because I'm writing out this plan, okay, so that's what, 2, 4, 6, 8, 10, 12, 13 sessions, okay? It doesn't mean that it's going to be sticking like this. If you do really good, we can always adapt this, okay? But it's best that we book you now because I tend to get busy. And if I have you in this plan of care, which is geared for your benefit based on your goals that we talked about, then not only will you get your sessions booked in, okay, but we'll be able to modify and adjust the schedule as needed versus trying to squeeze you in whenever I'm full, which gets a lot trickier later on. Okay? How does that sound? That sounds like a plan. We can always modify it, so I'm good with that. You're giving them an out. You've booked them into committing, and hopefully with the rapport that you'd have got, they would think that you know what you're talking about. Okay? Now, I also talked about how your timeline might change in terms of the healing rate. And then you take this person and with this paper and you give it to them as you walk into the front desk. This is your care plan. Now, one of the things you're going to have to try to get in the habit of is, as I hinted at before, that if I'm coming to for, in this case, I have on the screen a left shoulder, it's not just the shoulder that you're looking at. Because you must by now realize that if I'm coming to with a shoulder problem, there's obviously more to the shoulder. In the in the shoulder, you're looking at the glenohumeral joint, the AC joint, the SC joint, the scapulothoracic rhythm, technically the scapulothoracic joint. Okay, and that's not even including the neck. So really, what you're looking at is my neck, shoulder, elbow, and wrist, maybe. So you've already made it a full body image. Okay, and not only that, if you say, listen, how you stand dictates how your shoulder sits. Matt, you're right-handed, correct? Yeah, I am. Well, if you're right-handed, your right shoulder is going to be a little bit lower. Okay, that's just normal. Okay, but that creates a curve in your spine. So I just want to see you standing up, see how you line up, and so I can assess you basically from the bottom up, meaning your feet and your hips are basically what I would call the foundation of your house. And if the foundation of your house is crooked, then clearly your mid back and upper back and neck and shoulder are going to be crooked because everything's based on the foundation. Does that make sense? Yeah. Okay. Great. So do you mind standing up, Matt? I'm gonna take a look at you. We're going to start from there. We're going to see how you line up first, and that's how we go. Great. What did I do there? I made it a whole system look. I've already dropped the idea that not only am I looking at the shoulder, there's going to be other things that need to be addressed in most cases to help really correct you. Okay. And even though their goal is the shoulder, you're going to be slowly looking at other things to sort of show them that this is a long-term solution, because that's usually the case. I hope that makes sense. Now, results. Everybody is about results. Now, are you going to get a lot of results on the first assessment day? Probably not. Okay. But if you can do a test retest and you just get them to, for example, in the shoulder, hold my shoulder blade in the right position. The next thing you know, even though you're cueing or you're holding me as I lift my arm and I have no pain, holy smokers, you got a quick buy-in, because then you would have shown me, hey, if I do what this young physio is telling me, I can move my arm with no pain. Now, I don't know how to do that myself, but that's the whole point of me coming here, right? What do I get? I get instantaneous pain relief, okay? Test, retest. You get a wow factor. That builds so much trust right then and there in that 5 seconds that you did it, that almost everything after that is gravy, okay? So you have to be able to do these little subtle things. It gives me hope. And in the end, when a person's coming to see you in the clinic, what they're looking for is hope. That's what it is. And it's trivial. It's primitive. It's a primitive thought, but it's totally true. Because if I can't sleep, if I can't move my arm, if I've got unrelenting back pain, man, I can't see the end. I don't know if any of you have ever been in such pain. When you're in that kind of pain or that type of dysfunction, you just want it to end. You want to go back to the days that you'd had no pain. You want to envision yourself like you're 20 and you're like running in the grass with the flowers, like they do in the videos. Like, I mean, that's what they're trying to get back to. That's the motivation. And if you can show that quick win, I'm in. Okay. It also builds trust, by the way. There's always a delay in every slide because I have to go and pick the marker and put the color. So I apologize for that little delay. Evaluate is the next thing. Okay. So this is where you're going to do your clinical testing. Okay. You're going to educate the person and walk me through why you're doing this. Okay. For example, shoulder. Hey, Matt, I'm going to get your arms up here, palms up. We're going to test your biceps tendon to make sure that's what's not injured. So basically, Matt, we're going to put you through certain tests. I want to see how you move, how you don't move. Okay. What hurts? What doesn't hurt? Please always tell me what hurts, because that's very important for me to know. Okay. I'm going to systematically be doing tests to eliminate structures so I know that whatever is left is what's at fault. So that way I know there's a process. I get the sense you're doing this for a purpose. Okay. And then you can tell me, hey, you know what, this is going to be your bicep test. Let's just try to rule this in or out. Okay, that's negative. Great sign. Let's do this test, the empty can. That's supposed to be for your supraspinatus. Okay, things like that. So by doing all this thing, you're knocking things down. I'm thinking, hey, this guy's working his way through. All right, he's eliminating things. He's showing me how my shoulder isn't moving properly. Okay, it looks like it's not my bicep. Great. Oh, it's not my supraspinatus. I have no idea what the hell that is, but at least it's not that. So like you're chipping away. All right, and what happens? I start feeling positive about my injury. Okay, I don't think it's a tear now, or I don't think it's multiple tears. You see what I'm saying? Like the process of elimination and educating me while you're doing the test will help me be more relaxed. Okay, talk to me as if I'm a person. Talk to me as if I'm your grandmother, or in this case, grandfather, because really, how can I be a female with this very sexy voice? Okay, so like But by doing that and explaining to me what you're doing, you're reassuring me. I know what you're doing. There's a plan. This guy knows what he's doing. You might not even know what you're doing. Okay. But if you explain what you are doing, they will get the sense that you know what you're doing. That's key. Okay. That's all I got to say here. All right. Let me pick my marker color. Let's mix it up a bit and go with purple. It's my girl's favorite color. I don't know what it is, but all of a sudden it's like pink is no longer cool anymore with girls, which I really don't care. It's all purple. So my girls are in love with purple. Okay. So, anyways, just thought I would share that and bond and build rapport because that's what I do. So here we are. We're at the plan. Okay. So this is what I talked about. You are now going to say the last 15 minutes, in theory, to take that blank sheet of paper that I talked about before, the care plan, and fill it out right in front of me. Okay. Now, because you're filling out, we are filling out together. I'm giving you the goals that I want. I'm putting it in. I feel that I have input into this paper that you're putting in. You are taking what I'm giving you, blending it in with your assessment that you've educated me with throughout the assessment, and you're writing it all down. Okay? That's the setup. What does that do? That leads to a treatment plan buy-in. I get this piece of paper that I can take home and put it on my fridge. Okay? I can even take that paper and bring it to my family doc. So my family doc knows what's going on. Mind you, you're going to be writing a letter to your family doc. That's a separate issue. Okay. You've educated me. Okay. You've talked about their why statement, like why am I here, which I'll cover again later on. Right. You've talked about treatment interventions. You've talked about timeline. You've talked about home exercise programs. You've talked about prescribed sessions. That paper has everything that treatment plan has that I just highlighted, and therefore I am a fully informed person. You would have walked me through it. You would have addressed any concerns I have. Okay, you would have tried to address those concerns. But hey, Matt, what do you think? Does this sound good? Yeah. Okay. Well, what's bothering you? And you say, you know what? It's a lot of time. I don't really know. And then you reassure me. Listen, man, we're going to work on this, but we can always adapt. Okay, just because I'm saying this now, I'm just saying this based on my clinical experience and education and the way you're presenting. Not everybody is the same. I totally recognize that. So this might take longer. This might take shorter. Okay, it all depends on how well you do your exercise at home. Okay, cool. You make me accountable. Okay, you've turned the tables back onto me again. So I'm thinking, okay, this is on me. So if I really do this, I don't have to come here that often. Blah blah blah. You see what I'm saying? So you've got all that. So this is the key. And you've created this document that I can hold on to, something tangible, something I can go home and show my wife and my kids and say, hey, this is the plan, right? So it's always going to be there. This is no different from you leaving a doctor's office and walking with a script. Okay, it's the exact same concept. It's just a little gimmick. It's an effective gimmick, but it's a gimmick. Now here are some things that you can potentially say. I picked red. My bad. It's supposed to be purple. That you can say during that, like, Jane, based on these areas of body, let's go over what we are going to focus on. Okay, start circling things on the paper if you want. Do you see how if I focus on your mid back and your scapular control, you can see how your arm moved better and how you had more range? Yes, and how it hurt less? Yeah, I totally saw that. Well, then that's what we got to work on, Jane. Okay, so you can see how you're blending in your assessment, how you're going for that quick win fix that I was talking about before, and you're blending it all together. Now, the biggest thing here is you need to make this sound like this is the team thing. Okay, Jane, as we work together, I want to hear how your injury and pain is impacting your life. Let's start with how you're doing right now. Okay, these are all things you can bring in during the assessment. Now, here's the thing: as we work together, because you have to make them feel that this is a team scenario. It's not me telling you what to do. It's not you telling me what's sore. It's us working together. If you got to tell, listen, we're a team now, and I'm here to get you better, and I need your input, and I need to work with what you got. Okay, this is about us building a relationship together so we can get you to where you want to be, hands down. Notice how I said that. It's us for us to work together to get you where you want to be. Did I talk about the pain? Hey, did I talk about how all this negative? No, I made it sound like it's a bonding scenario for that we can just sort of do things together. Okay, Jane, I want to see how you're doing. We're going to modify things. I want you to get that. I want you to be able to do that volleying. More importantly, I want that night pain to go away, and I want you to understand, Jane, the night pain is always the last thing to go away. So you're going to find in time And instead of always being sore, sometimes you'll have bouts of no pain and bouts of pain. Then eventually it'll be days of or moments of no pain and then some pain, and eventually pain, no pain, period. It's a gradual transition, okay? And I need you to tell me these things so that I know where you are, so I can adapt and make things better or easier for you based on how you're presenting, okay? These life items should change as we work together. Do you see why it's important to talk about how you go through your day? See, I completely preset the tone in that scenario. Now, just go to Reddit, it's easier. On that treatment plan, you're going to be writing down things in that box, okay? And this is what you're gonna talk about. Like, you know what, Jane, here the goal is to do this, okay? Goal A is to do this by this time. Goal B is to do this by this time. So you're taking it, you're taking all information, you're writing on the paper in a different format, but in the exact same concept, so that they see it written down in a different way. Is it customized to them? 100%. Do they feel it's being more specific for them? 100%. Are you writing the exact same thing over and over again? 100%. Okay. I always, always, always focus on function. Okay. I don't really spend a lot of time focusing on pain. I don't see the point in doing that, because if you come to me and you tell me, hey, Matt, I can only move my arm from 0 to 10 degrees and I got 10 out of 10 of pain. And then later on in physio, X number of weeks, whatever the case is, I'm now moving my arm up to 120 degrees with no pain. But once I hit 120 degrees, I tell you I still have 10 out of 10 of pain. I'm going to tell you I'm not any better. But then you're going to say, hey, Matt, look, I get what you're saying. But now you're only getting pain at 10 at 10 at 120 degrees. Look at all the things you're able to do now. You can comb your hair, you can make your dishes, you can fold the laundry. You're not getting the pain. Now the only time you get 10 out of 10 pain is in reaching up to get something out of the cupboard. And it's higher up, right? Yeah, okay. You're right. Your pain's exactly the same. But your pain's exactly the same at a higher range, and you're doing all these other things in the meantime without any pain. So what do you think? Are you getting better now? Yeah, I guess I am. Okay, so you see what I'm saying? That's the way you word it. That's how you play with it. Okay, you ask, hey, what do you want to get back to? Okay, if you weren't sore, what would you be doing? Okay, so then if you say, you know what, I haven't been able to get back to volleyball for like 4 months. Okay, or I just want to be able to sleep at night without being woken up all the time. Well, you know what? Then that's what we're going to shoot for. So awesome. Let's go after that. Okay. Again, you've given me hope. You made it specific for me. You haven't focused on the pain. You're working on the function. That's the key. It's always been that. Okay. And if you can tap into my hope and I can believe in you and you build a rapport, I'm yours. Yeah, at least from the first day. You still got the second, third, and the rest of the other sessions to address, but that's a separate topic. Now, treatments. Jane, let me take you through some treatments I want to incorporate. I've used these treatments with other patients with your type of injury and pain. Okay, so here you are, and you're talking about things that you want to do. Okay, I want to work on your scapular stability. I want to be able to get you to raise your arm with control. I want to strengthen these muscles. Okay, I want to maybe use some ice and some ultrasound as to help with pain or whatever the case is. During this scenario, I'm telling you what the plan is. Okay, I'm incorporating all the things that we've seen on the assessment, which I've explained to you while I was doing. Okay, I'm giving you some input in terms of how we're going to do this. Okay, and by doing all that, I, as a client, feel like I have a part of this plan, and that's key. Because if I feel I'm included, then my probability of being a self discharge drops down quite dramatically. Now, in that same scenario, understand these are all scripts. I'm just giving you some ideas to what to use to talk to the person if you're not sure how to do it. And these are all in theory. I don't expect you to memorize these scripts. Like, these scripts are just guidelines. It's all about going with the flow and feeling out the person and being able to talk. What you want to do is you want to hit these key points. Jane, I want to take you through your treatment plan timeline. So now we're going through stages of healing, okay? This is what it's all about. First 2 weeks, boom. I may include a little bit of this, okay? We don't do biofreeze because that's voodoo, okay? I actually don't believe in foam rolling because that's voodoo as well. AccuBall is nothing but a glorified foam roller, so I don't do that. But that's me. If you want to do that, go ahead. One day, you and I will have a physiological discussion of how useless that is, and then you'll realize, you know what, Matt, you're a genius. And I will say, yeah, you're right. It's hard to be a genius all the time. But that's a separate discussion about my genius ability. So, but the point is, in week 3, 4, 5, we're going to focus on this. Week 7, 8, 9, we're going to focus on this. And overall, you're going to see how I've talked about weeks. I've talked about stages of healing. I've talked about goals and how I'm going to progress. So you've blended the whole thing. So I'm not coming here. I'm hopefully leaving here with the idea that, you know what, this is not going to be a 1 or 2 visit scenario, and this is going to involve some type of commitment. But you know what, this Matt person or Peter person seems to really know what he's doing. He's making me feel at ease. He's addressing all my concerns. Okay, where I have some input into this. So this sounds like a plan. Okay, and I'm excited, and more importantly, I have hope. Now, who is a subject matter expert? You are, not the patient. Understand that. So if you say it's going to take 3 to 6 weeks, it's going to take 3 to 6 weeks. Again, you can talk about stages of healing. Nothing beats the argument of stages of healing. You can talk about how the shoulder is a multi-system scenario. There's multiple joints. It's not just moving your glenohumeral joint, okay? So the way you present yourself, the way you explain everything, the way you set this up goes with the timeline. I think you need 13 sessions. Okay, and here's what we're going to work at. It's going to take a little bit of work on your part in the beginning. And we're going to try to book all your appointments today because we want to get all the time that you need, and then we can set the plan. Because once we set the plan, then we know exactly where we need to be and we can progress you. Without this plan, then we're going to be winging it on a weekly basis. The problem with that is, 1, I might not have the openings. 2, you might not have the time for that opening. And more importantly, we're going to be winging it because the commitment isn't there, and I'm not going to be able to get you as strong, as efficiently as I need to be. Okay, and that's kind of how you word it. Right? There's a little bit of play in words, but understand that I'm driving that conversation, not them. Again, I don't care what Google or Muscle and Fitness says. All right, this is your time. Again, you're the subject matter expert, and please believe in what you're saying. Because if you don't believe in what you're saying, you think this is a money grab, then you're done. Okay, because this is not a money grab. This is you getting them fixed. And if you can't get them fixed, if they're not in the clinic, it's really that simple. That is the fundamental rule. All right, now this is where I was talking about calling them out. So at the very end, which I'll review again on the sheet, I think it comes down later on. Okay, when you've done everything, like I said, I should be somewhere around a 7 out of 10. Whoops, that's a terrible 7, but you get the idea. Yeah, let's just improve that because that's going to affect my OCD. Okay, so that's my 7 out of 10. All right, now, what do you think of this plan out of 10? I'm thinking a 7, maybe 6. Okay, great. Can you tell me what you think I need to talk about more to get you more committed, so I can get you at least to about an 8 or a 9 out of 10? Okay, and you sit and you wait. When you make the comment, wait. Don't say anything. Let them come up with an answer. If you say, Matt, like, what can I do to get you a 10 out of 10? You wait 2 seconds. Is it this? Is it this? Is this? You've already lost the bargaining scenario. This is very much kind of like car shopping, okay? I'm only prepared to pay $10. Keep your mouth shut. Just wait. Let the car salesman see what he says next. The instant you say, well, you know, 10, I can probably go to 11. Then you left the window open. Once the window's open, the car's like, hey, man, it ain't going to be $10 for you. It's going to be 15. 15 smackaroonies, or you're not going to get a car. Okay, so what can I do to get you there? Like, what number? To get you like an 8 or 9 out of 10, what do I need to do? Okay, and then wait a couple of minutes. I will come with an answer because I'll feel uncomfortable, right? And as soon as I feel uncomfortable, I'm going to have to respond. Now, let's just say 2-3 minutes go by, nothing comes out. Okay, then it's like, all right, well, tell you what, this is kind of the way the healing rates go. Okay? And based on my experience working here, working as a physio, and based on all the studies and all the people that are in this clinic, these are the things that we need to do. Right? So why don't you trust me and let me get you there? And you will see that in many ways, what I'm doing is right on the ball. Obviously, I'm going to adjust this based on how well you're doing. This is going to be a daily adjustment of your bookings. But that having been said, if I don't book you now and we don't try to get you in the system, it's going to be really hard to get you there. And I don't want to compromise your rehab. I want to get you back to volleyball as soon as possible. And I think this is the best way of doing it. What do you think? All right. All right. Maybe I might move from 7 to an 8. That's cool. Right? If I talk about cost, then there's all sorts of scripts we can talk about. That's something you can talk about with your clinical director, who will be reviewing other strategies with you, but based on scripts. But this is not a script thing. This is about the treatment plan right now. Okay. You've written up the treatment plan. You asked me what my commitment was. Okay. So that way you hopefully addressed my questions to get me a little bit closer to the 10 mark. Okay. You've rebutted the patient's questions, price, coverage, scheduling. Okay? Again, all things to be discussed with the clinical director, because this is not about that. This is all about the treatment plan paper. Okay. Um, so now that basically takes care of the accountability section. Okay. Now, this technically isn't directly related to the treatment plan, but I wanted to put this in here anyways. Okay. And that is your assessment letter. You all have to write an assessment letter. It's the only build a connection to your family, their family physician. And when they see enough of your letters with your name, especially when you're discharging them and the patients are happy and the patients go back to the doctor and say, "Hey, Dr. Singh, I saw Matt and I was there for X number of times, but my shoulder is great." The doctor hears that, they remember these things. The doctors are overwhelmed. They want to send their clients off their case to someone who can get them fixed. That's what it boils down to. Okay. So if they know that they're going to send them to this clinic with that big massive logo on the letterhead, and they see Kirsty, I haven't mentioned her name, okay, then if they see Special K, he knows that she will take care of them, and that's one less person he or she has to deal with. Okay, so that's where those doctor's letters come in, and that's very much related to the treatment plan. If the client takes that treatment plan to their doctor, the doctor sees what the plan is and how often they're going. The doctor's going to feel some type of reassurance because he knows that there's a plan. Okay, and there's a negotiation in terms of goals. The doctor will see and appreciate all that. That's where all this ties in. Let's go back to the treatment plan that I talked about in the beginning. Oh, I need my marker. Let's get some purple. All right. So your expectations. Okay. If I was 100%, I'd be doing V-ball. Okay. What did we say? 2, 2, 2, 2, 2, 1, 1, 1, 1, 1. There. 2, 4, 6, 8, 10, 12, 14, 15 prescribed sessions. Milestones. Phases of the healing are right here. Okay. Acute. Subacute is here. Fibroblastic is what here. Maturation is to infinity and beyond. All right. So treatments will consist of this, this, this. We focus on that. This automatically is fixed. Right. First goal is to get you moving to 90 degrees with no pain. Second goal is to get you lifting weights above 90 with no pain. All right. You're going to learn how to control your scapula. For now, we don't want you going above 90 degrees because that's going to poke the bear and make your shoulder angry. What do you think of the plan, Matt? Okay. I'm not writing it all down right now because I'm using a mouse, and first of all, my handwriting sucks, let alone writing with a mouse is even worse. What do you think of that plan, Matt? If you were to give me a number out of 10, what would you say you are in terms of commitment? Okay, so you're waiting. All right, so now I reply 7 out of 10. Okay, 7 out of 10 isn't bad. That's not bad at all. Okay, I like that number. Matt, what can I do to get you closer to a 9? Tell me. What issues or concerns do you have? Now you're waiting. Well, commitment and blah, blah, blah. Okay, well, let's talk about the commitment. Stages of healing are this. We can't change that, all right? Like the rules of physiology don't change for anybody. Just because you're an athlete doesn't mean you heal faster, okay? You might see that on Google, but that's completely untrue. So I have to respect these rules. But here's what I can do. If I can get you stronger and more coordinated, is your pain going to be lowered quicker? Yes. Okay, but if your pain is lowered quicker, does that mean you're healed based on the rules of physiology? The answer is no. Okay, so I can definitely get your pain levels down a lot faster just by working on your function. And we'll deal with the healing as time goes on. Okay? And there's optimal healing, and there's healing where there's all sorts of compensations. You're already compensating as it is. So why don't we get you to stop compensating in that shoulder or neck or mid back? And if I can get you moving better, not only will you stop compensating, you'll stop irritating the shoulder. The shoulder is going to settle. Your pain goes down. Then we just work on strength. I get you stronger. We deal with all these multiple functions, dysfunction that we talked about in the assessment, about how you're kind of leaning off to one side. There's, I think, maybe something going on in your lower back as well, but we'll deal with that later. Right now, let's just get your shoulder moving. Okay, great. We'll start with that. Okay, now you got me at about maybe a 9 or an 8 out of 10. Great. So here's what we're going to do. Obviously, we're going to modify this plan based on how you're doing. Okay, but if you've got no any other questions, I'm going to walk you to the front desk, and I'm going to hand you off to Kathy. I think she's the one who's working up there, and Kathy's going to take this paper, scan it in, put it in the system, and then she's going to book you for your sessions. You good? Do you have any other questions to ask me? No. All right, cool. Let's go to the front. I'd be happy to take you there. Now, as you are walking me to the front, okay? Now, look, it's really important to book all these appointments, and I'm going to tell you why. I get busy quick, okay? Especially if, like, for example, it's me, Matt, the owner. My schedule is ridiculous. I'm always full. And if I'm not always full, I'm pretty damn close to always full. So if you don't pre-book, you're not going to see me. Like, I mean, it's just, I can only squeeze so many people in at any one time, especially during COVID, because I'm restricted in terms of space and timing. But even if it wasn't for COVID, I still only have so many beds I can bring people in. So, like, it's important that I pre-book people, okay? So this is the way I say, listen, I get really busy very quickly, okay? So we're going to use this treatment plan. We're going to book these 15 sessions. We can always change them later on, all right? But here's the bonus. You get the time that you want. There's no last minute stress over trying to get in, trying to squeeze in. And if we can stick with the plan and get you some steady treatments, I can get that shoulder much better, okay? A lot quicker versus us sort of figuring out when you can come in. And also, it'll get you committed. And if I can get you committed, I can get you better so much easier, okay? Great. They take that paper to the doctor. The doctors see all this stuff, okay? The wow factor for the doctor, if they take it to the doctor, the patient's able to explain their treatment plan because you've already written it all to them. The patient can explain it to their friends or their family if they put it on their if they keep it in their wallet. Some people do that. I don't know why. They might leave it on their fridge, whatever the case is. There's all these buy-ins, the secondary effects that comes from that paper if they take it home. Okay, so this is how it all ties in. The handoff. This is, I think, the second most critical part of this care path, next to your ability to connect to them. No connection, you're done. If you connect with them and you've done all this well, you have a crappy handoff and you fumble the ball, you're done. Okay? So I don't care how busy you are during your assessment in the clinic. Walk them to the front desk. Treat the patient as if they're your grandmother or a grandfather. Okay? Walk them up. Make them feel comfortable. Show them that you care, because we do fundamentally care. Okay? They see that extra attention you're giving to them, and you go to the front desk. So the front desk, I guess in this scenario, is Jim. Jane is the patient. Okay? So you go, hey, Jim. This is Jane. Here's her treatment plan. Please book all the visits. Jim's going to take care of you. She's awesome. She'll set you all up, and the sooner we get you started, the sooner I can get you back to tennis. All right. Now, that didn't sound too natural because of the fact I'm using these cheesy names that I wrote on the screen. But in the Orleans clinic, which is where I work, and I predominantly work with Estelle, I go, hey, Estelle, here's John. John's got a shoulder problem, but we've got a plan here. So here's a treatment plan. And if you can book him for twice a week for these weeks and then 1 week after, as per the paper, it sets the plan. He knows what to do, and he knows what exercises he needs to work on. So Estelle, can you just make sure he's taken care of it and take care of him? Estelle will say, yeah, sure, I've got this, no worries. And then Estelle will take this paper, whatever the guy's name is. Hey, Jim, okay, you know what? I've got you. We're going to book all these sessions right here and make sure you get your times you want. how are these times? And Estelle starts doing her thing and doing her magic. And Estelle is going to chat with them a little bit more to seal the deal. Okay. And then after that, what they're going to do is they're going to book the appointments. Okay. That original paper goes back to the client. The paper is uploaded in their form. And then front desk fills out something called a NAR, New Assessment Registry. Okay. Now, here's an added bonus that I think you should all really think about. The next day, take 2 minutes. Call your new assessments from the day before. Leave a voicemail. Okay, it shows that you care. Who knows? They might have buyer's remorse. So if you talk to them on the phone or leave a voicemail, it's an ability for them to maybe call you back. Okay, and it's a very inexpensive way to prevent patient self-discharge. How many people actually call them right after the assessment? Almost nobody does. Okay. Though we send emails right after every assessment to see how their experience was, what do you think is better? Some predetermined email or a personal phone call from their physio? You have to understand that though you guys are all self-employed, or if you're an employee format model, which we're not, but let's just say you are, your ability to bond with that client and show that you truly care is so key, it's insane. A little phone call here and there, yeah, does it take a little bit of time on your part? Yes. But think about it. These people are booking way beyond 1 or 2 weeks. Your schedule is going to be 50 to 60% full, 2 to 3 months ahead of schedule. Okay? You're doing all these small phone calls. And what does it mean? All these little things all add up to you having a full schedule. If you have a full schedule, a couple things. Are you stressed over your schedule? No. Are you happier because you know you're doing a great job and your clients are getting better? Yes. Are you also happier because your schedule is full, so therefore you're getting a lot of income? Yes. Is there any stress or negative issues going on in that scenario if you're doing really well and the clients really believe in you and they're getting better and they're happy? No. Okay? Everybody's happy. There are no issues. That's why we became physios. We became physios to help people. We became physios to help people and get paid at the same time, though. Okay? So, like, there's nothing wrong with doing all these subtle things because all these little things, those doctor letters, those little take 2 minutes and call a person and don't send an email. It's so impersonal. Okay? But these little things, it makes a huge difference. It's insane how it does, how much of a difference it makes. I do these things all the time. Okay? I do sometimes send emails. I'm not gonna lie to you, but that's when I know them well enough. Okay? But they come and they know that you care and that they believe in you, and that's really what the key is. It's all about the bond. Okay? Now, when the front desk takes this form that you've given them, I apologize how small this was. You can't see it that well. I get it. Okay, but I just used a sample. The front desk will input the patient's name, which physio they saw. So we'll just pick on Nick. They came in for physio. The admin, so the person at the front desk that booked it was Krista. Was a treatment care provided? Yes. The number of sessions prescribed, we'll say 15. How many appointments did the patient book? We'll say 14. All this gets automatically dumped into a Google Sheet, which then goes into, which then the clinic director will take a look at. So we will know if you are, one, using this plan, and it better be yes for everybody. Okay. Two, we're going to see how many visits you are actually prescribing. And then we'll see how many visits the client is booking. So then we can see, look, if okay, we'll pick on here. We'll pick on. Okay, I won't pick on Camille because I don't know her that well just yet. Pick on Olivia. So Olivia is only booking people at 3 visits. Okay, so her prescribed sessions are only 3. Well, why is she doing that? Is she doing that because she's not comfortable asking people to come in? Is she doing that because she thinks people's insurance companies only allow 3 visits? Don't limit yourself by the number of visits that the insurance company will cover. If you build a bond, they will pay. Don't tell me that just because they can't afford physio, they're not on Amazon right now ordering a television. Because they are. So you have to be able to build that bond. All right. Now, if you're asking for 15 assessments, if they're only consistently only booking, we'll say 1. Okay. Well, then obviously your ability to build rapport and bond to the client needs some work. Okay. Or maybe in the handoff, because we're also keeping track of who the admin is booking. Maybe the admin's doing a terrible job in booking it. Well, maybe not a terrible job, but you get the idea. Something we need to work on. Clinic directors are going to be able to see all this because the NAR is going to show that, the new assessment registry, NAR, sorry, okay? And we can organize the filters and say, show me all the bookings done by Jennifer. And if Jennifer consistently has a book to prescribe ratio of lower than 3, then we know that it's not the physio that might need some work, it's the admin. If it's both, then we need to do both. But the point is, this gives us objective measures. It shows you how well you're prescribing sessions and how well they are booking. And that is key because the two biggest challenges for any physio, especially new grads, is one, book to prescribe ratio. How many assessments and visits are you booking on the first day? The next one is retention. If they book all those sessions, do they come for those sessions? That's a separate discussion, okay, and that's a separate topic that you'll be working on with your clinical directors. This entire presentation is just to work on the treatment plan strategy and that new form that we're going to be using for every new assessment going forward. And that's what this whatever online video YouTube thingy is all about. Okay, you're always welcome to ask me any questions. You're always more encouraged first to talk to your clinical directors, okay, because that's what they're there for. And if they aren't able to answer the questions, talk to me. My door is always open, but I like to follow the sequence of events or people to talk to, just so that they can help you out first because they're with you on the floor more than I am. Anyways, I hope this was helpful, and I'll see you guys soon, guys or girls soon. Bye.